The early morning sun streamed through the windows of Westbrook Memorial Hospital, casting long shadows across the polished floors of the emergency department. Dr. Maya Patel adjusted her wrinkled scrubs and checked her watch for the third time. 7 a.m. The department head's monthly staff meeting had started without her. She wasn't surprised. Through the conference room's glass walls, she could see the familiar faces of her colleagues discussing the upcoming hospital merger and staffing changes. Laughter punctuated their conversation as someone cracked a joke about the outdated equipment. In the East Wing, Maya knew exactly which equipment they meant. Before we jump back in, tell us where you're tuning in from, and if this story touches you, make sure you're subscribed, because tomorrow I've saved something extra special for you. "Morning, Patel," called out Dr. James Harrison, barely glancing up from his patient chart. His tone was polite but distant, the kind of acknowledgement you give to a hospital volunteer or a medical student. "Morning," Maya replied, but James had already turned back to his conversation with the other attending physicians. At the far end of the emergency department sat her assigned station, an older section of the ED that had been scheduled for renovation. For the past 3 years, the paint had faded to a dull beige, and the equipment, while functional, was at least a generation behind what the other doctors used. "Still working in the dinosaur wing, I see," came a voice behind her. Maya turned to find Dr. Victoria Reynolds, the hospital's chief of emergency medicine, approaching with her characteristic smirk. At 52, Reynolds had carved out her reputation by managing hospital politics and budget allocation rather than handling critical cases. Her white coat was always pristine, her designer shoes clicking confidently on the tile floor. "The equipment is still functional, Dr. Reynolds," Maya responded evenly. "Functional, sure, but hardly what I call state-of-the-art," Reynolds' eyes swept over the older monitors with obvious disdain. "You know, Patel, there's been talk about reassigning you to the outpatient clinic. A less intense environment might be more suitable." The words hit like a physical blow, but Maya kept her expression neutral. "I prefer emergency medicine, Dr. Reynolds." "Of course you do, but preferences don't always align with reality." Reynolds glanced at her tablet, scrolling through what appeared to be personnel files. "When was the last time you handled a major trauma case?" Maya's jaw tightened. 3 years ago. She'd been leading trauma responses, dealing with the most critical patients who came through the doors. She'd developed an innovative protocol for treating crush injuries that significantly improved survival rates. Her research papers had been published in respected medical journals, documenting life-saving techniques that challenged conventional approaches. Her findings had been noted, filed, and ignored. 2 months later, a patient had died under the care of Dr. Eric Winters, using the standard protocol that Maya had argued against. The official report blamed unavoidable complications and pre-existing conditions. Maya's name wasn't mentioned. Shortly after, she'd been quietly reassigned. No suspension, no formal reprimand, just a change in duties. The phrase used was strategic reallocation of expertise, but the message was clear: stay quiet, stay out of the way. "I'm ready for any assignment, Dr. Reynolds," Maya said, her voice steady despite the anger building in her chest. Reynolds' smile was patronizing. "That's the spirit. For now, stick with the routine cases. At least it matches your experience level." As Reynolds walked away, Maya felt the familiar weight of isolation settle on her shoulders. Around her, the emergency department hummed with activity. Doctors assessed incoming patients, nurses administered treatments, and somewhere in the staff meeting, case assignments were being distributed to everyone except her. She walked over to her station and organized her supplies for the day. The equipment might be older, but it was meticulously maintained. This section of the ED had treated thousands of patients over the years, had seen more medical emergencies than most of the newer physicians had in their entire careers. "Don't listen to them," said a quiet voice behind her. Maya turned to see Nurse David Chun, one of the senior ed nurses. His scrubs were slightly faded from countless washings, and his weathered face spoke of decades spent caring for patients. "These old days have seen more real medicine than half the shiny new equipment they're pushing these days," David continued, nodding toward Maya's station. "And you're one of the few doctors left who knows how to treat patients instead of just following algorithms." "Thanks, David, but it doesn't seem to matter much anymore." "It will," David said with quiet conviction. "Sooner than you think." As if summoned by his words, the emergency alert system blared across the department. Maya looked up to see the trauma notification board flashing red. Somewhere out there, a major incident had occurred. Inside the conference room, voices rose in urgency. Radio communication crackled with tension. Maya felt her pulse quicken with the familiar pre-crisis adrenaline, but she remained at her station, waiting for instructions that probably wouldn't come. The forgotten doctor and her forgotten corner of the ed, watching from the sidelines as the real action happened elsewhere. Preparing and narrating this story took us a lot of time, so if you are enjoying it, subscribe to our channel. It means a lot to us. Now back to the story. But Dr. Maya Patel had learned long ago that being underestimated was sometimes the greatest advantage of all. The conference room buzzed with controlled chaos as Maya slipped through the back entrance. She wasn't officially invited, but nobody had explicitly told her to stay away either. She found an empty chair in the back row, notebook in hand, trying to blend into the beige walls. Dr. Reynolds stood at the front of the room, beside a large digital display showing a map of the city. At 07:05 hours, there was a major chemical explosion at the Northside Industrial Complex, Reynolds announced, her voice carrying the authority of someone who rarely dealt with actual emergencies. "We're looking at a mass casualty incident with potentially hundreds of victims. The plant manufactures industrial cleaning agents, and the fire has released unknown airborne toxins." Dr. Harrison, the department's rising star, raised his hand. "What are we looking at in terms of chemical exposure? Any details on the agents involved?" "Preliminary reports indicate a mixture of industrial solvents and ammonia-based compounds," Reynolds replied smoothly. "The hospital's toxicology team is preparing standard decontamination protocols." Maya frowned, pulling out her tablet. She'd been researching industrial chemical exposures for years, tracking patterns of symptoms and outcomes across similar incidents nationwide. According to her analysis, standard protocols would be inadequate for this particular combination of chemicals. She raised her hand tentatively. Reynolds' eyes flicked to her with barely concealed irritation. "Yes, Dr. Patel?" "Dr. Reynolds, I've been studying similar industrial accidents, and I'm concerned about the standard decontamination approach. The combination of these specific solvents with ammonia compounds can create secondary respiratory damage that won't respond to." "Thank you, Dr. Patel," Reynolds cut her off with a dismissive wave. "But I think we'll rely on the toxicology department's official recommendations rather than personal research projects." A few doctors chuckled, and Maya felt heat rise in her cheeks. She looked down at her notebook, filled with meticulous notes on chemical exposures and innovative treatment approaches that represented hundreds of hours of careful analysis. In the front row, she noticed Dr. Sarah Lynn, one of the few colleagues who still treated her with respect, glance back at her with what might have been sympathy. "As I was saying," Reynolds continued, "we'll be dividing into trauma teams. Alpha, Beta, and Charlie teams will handle critical cases. Delta and Echo will manage intermediate severity. The remaining teams will handle walking wounded. We anticipate the first ambulances arriving within 15 minutes. Maya studied the team assignments on the main screen. Every doctor in the department was listed except her. Even the newest residents, fresh from medical school, had been assigned to response teams. "What about Dr. Patel?" called out one of the younger residents. Isn't she on the roster today? Reynolds' smile was thin. Dr. Patel will be managing routine cases in the East Wing. Her expertise isn't required for this response. The dismissal was public and humiliating. Maya felt dozens of eyes on her as she closed her notebook and prepared to leave. But as she reached the door, Dr. Lin caught her arm. "Maya, wait," Sarah whispered. "Your research on chemical exposures, can I see it?" Maya hesitated, then handed over her tablet. Sarah studied it intently, her brow furrowing as she reviewed the treatment protocols Maya had developed. "This is incredibly detailed work," Sarah said quietly. "Have you submitted this to the toxicology department?" "I tried. They said it was interesting but speculative and couldn't be incorporated into official protocols." Sarah looked up, her expression troubled. "These respiratory complications you're predicting, they're not covered in the standard response protocols we're about to use." "I know. I've seen similar cases during my fellowship at Boston General. The standard approach won't be enough for severe exposures." "Then why aren't you briefing us on this?" Maya glanced toward the front of the room where Reynolds was explaining decontamination zones. "Because I'm not on the team anymore. I'm just the backup." That afternoon, Maya sat in her quiet corner of the ED, updating her research notes on chemical exposure treatments. Through the department doors, she could hear the controlled commotion as the hospital prepared for the incoming casualties. The first ambulances had already arrived, and the trauma bays were filling quickly. Nurse Chun appeared in the doorway, his face grim. "Thought you should know it's bad. Over 500 workers were at the plant when it blew. They're bringing them in by the dozens." "Thanks, David," Maya said, setting down her tablet. "Are the decontamination protocols working?" David hesitated. "Not exactly. We're seeing unusual respiratory symptoms that aren't responding to the standard treatments. Dr. Reynolds is sticking to the protocol, but—" He trailed off, his concern evident. Maya pulled up her research data, comparing it to what David was describing. It was exactly what she had predicted. The chemical combination was creating a unique form of respiratory distress that standard protocols couldn't address. "Maya," David said, settling into a nearby chair, "I've been a nurse here for 29 years. Seen a lot of doctors come and go. Most of them think being a good doctor is about following protocols and using the latest technology." He paused, his weathered hands fidgeting with his ID badge. "But the best physicians I've ever known were the ones who understood that medicine is about seeing patterns that others miss and having the courage to act when the standard approach fails. You're one of those doctors, Maya. Don't let anyone tell you different." Maya looked up from her. "Research, even if they never give me the chance to prove it?" "They will," David said with quiet certainty. "Trust me on this one. When things go sideways, and they always do, eventually they'll come looking for someone who can actually think beyond the protocols." As if summoned by his words, the hospital's emergency alert system blared again, this time with the distinctive pattern indicating a critical situation. Maya grabbed her stethoscope and hurried to the main ED where chaos was erupting. "We've got 30 critical respiratory distress cases and more coming," shouted the charge nurse. "The standard protocol isn't working. Oxygen levels are still dropping. Stick to the decontamination and bronchodilator protocol." Dr. Reynolds commanded from the center of the floor, her voice strained but authoritative. "The toxicology department assures me this is the correct approach." Maya watched as nurses and doctors scrambled to treat patients who were clearly not responding to the standard interventions. In one trauma bay, she could see Dr. Lin struggling to stabilize a young man whose oxygen levels were plummeting despite being on maximum supplemental oxygen. "Dr. Reynolds," Sarah called out, her voice tight with controlled panic. "We need a different approach. These patients aren't responding." "The protocol is clear, Dr. Lin," Reynolds replied, her voice betraying a hint of uncertainty. "Continue." with the established treatment plan. Maya's blood ran cold as she watched more patients arrive, many showing the exact symptoms she had documented in her research. The specialized respiratory damage was occurring exactly as she had predicted, and the standard treatments were proving ineffective. She grabbed her tablet and headed for the medication dispensary. David followed her, eyebrows raised in question. "Where are you going?" he asked. "To do what I should have done this morning," Maya replied, her voice steady with newfound resolve. "I'm going to save these people." The emergency alert system wailed across Westbrook Memorial as Maya sprinted toward the pharmacy. The radio communication system filled the air with increasingly desperate transmissions from the various trauma teams. "Patient 42 is crashing. The bronchodilators aren't working. We need more ventilators in Bay 3. Oxygen saturation is dropping below 70% despite maximum support." Maya's heart hammered as she recognized Sarah's voice, maintaining professional calm despite the underlying terror. The number of critical patients was overwhelming the department, and the standard protocols were failing catastrophically. Maya reached the pharmacy and began gathering the medication she needed based on her research. Her hands moved with practiced efficiency, selecting specific anti-inflammatory agents, specialized surfactants, and alternate bronchodilators that her research indicated would address the unique chemical damage. "Dr. Patel." Dr. Reynolds' voice cut through the chaos as she strode across the department floor. "What do you think you're doing?" Maya continued preparing medication doses, her focus unwavering. "I'm implementing the treatment protocol from my research. Dr. Reynolds, the standard approach isn't working because these chemicals are causing a unique form of inflammatory response in the lung tissue. You are not authorized to deviate from established protocols," Reynolds said, her face flushed with anger. "Return those medications to the pharmacy immediately." Through her headset, Maya could hear the growing desperation in the doctor's voices as more patients deteriorated. "Dr. Reynolds, people are dying because the standard protocol doesn't address the specific pathophysiology we're seeing. My research shows that this combination of medications can reverse the damage. Your unauthorized research means nothing in a crisis situation." Reynolds' voice rose sharply. "If you proceed with this, I'll have security remove you from the department." Maya felt a familiar stab of disappointment. Even now, with lives literally hanging in the balance, institutional pride mattered more than doing what was right. "Dr. Reynolds," she said quietly, "you don't have to follow my lead, but I'm going to treat these patients either way." She moved past Reynolds toward the critical care area where the most severe cases were concentrated. The trauma bays were filled with patients gasping for breath, their skin taking on the bluish tinge of severe oxygen deprivation. At one bed, she saw Sarah struggling to intubate a middle-aged woman whose oxygen levels had dropped to dangerous levels. "Maya," Sarah called out, relief evident in her voice. "Please tell me you have something." "I do," Maya replied, quickly explaining her alternative treatment approach. "These chemicals are causing a specific inflammatory cascade that's standard bronchodilators can't address. This combination should stabilize the lung tissue while counteracting the chemical damage. The protocol specifically prohibits experimental treatments," said Dr. Harrison, who was working on a patient nearby, his usual confidence shaken by the failing results around him. "This isn't experimental," Maya replied firmly. "It's based on documented cases and rigorous research. I've been studying these chemical interactions for 3 years. I don't care if it's unauthorized," Sarah said, her patient's monitor showing dangerously low oxygen levels. "My patient is dying." "What's the dosage, Maya?" Maya quickly administered the medication combination to Sarah's patient, carefully explaining the mechanism of action and expected response. "We should see improvement in oxygen saturation within minutes if my analysis is correct." They watched the monitor anxiously as the seconds ticked by. Slowly, the oxygen saturation numbers began to climb from the critical 60s into the 70s, then the low 80s. "It's working," Sarah whispered, checking her patient's breathing. "The respiratory effort is already decreasing." Around them, other doctors had paused to observe the unexpected improvement. Dr. Harrison stepped closer, his skepticism giving way to desperate hope as he watched the patient's vital signs stabilize. "What exactly did you give her?" he asked, all traces of condescension gone from his voice. Maya explained her treatment protocol quickly but thoroughly, highlighting the key differences from the standard approach and why it addressed the specific chemical damage they were seeing. "I have patients who need this now," Harrison said, his professional pride giving way to practical necessity. "Can you help us implement this across the department?" "Dr. Patel is not authorized to change treatment protocols," Reynolds interjected, having followed Maya to the trauma bay. "This is a clear violation of hospital policy." "With all due respect, Dr. Reynolds," Sarah said, gesturing to her now stabilizing patient, "the authorized protocol is failing and patients are dying. Maya's approach is working. We need to implement it immediately." Reynolds' face tightened with anger. "Any physician who deviates from the established protocol will face disciplinary action. I am still the chief of emergency medicine." Maya felt the weight of years of dismissal and marginalization, but also the immediate responsibility to the hundreds of suffering patients around her. She thought of her research that had been ignored, of the protocols that prioritized institutional convenience over patient outcomes, of all the time she'd been told to stay in her lane. "Dr. Reynolds," she said, her voice firm but calm, "in approximately 10 minutes, patients will begin dying from respiratory failure that could have been prevented. You can report me to the medical board tomorrow, but right now, these people need the right treatment." She turned to the gathering circle of doctors and nurses. "Anyone who wants to save their patients, listen carefully. I'm going to explain exactly what we need to do." For the next hour, Maya directed a complete reconfiguration of the emergency department's response. She organized the staff into specialized teams, each focused on a different aspect of her treatment protocol. The pharmacy scrambled to prepare enough medication, while respiratory therapists adjusted ventilator settings based on her specifications. "The key is understanding that this isn't just chemical pneumonitis," Maya explained to a group of residents as they prepared treatments. "The specific combination of solvents and ammonia is causing a unique form of damage to the alveolar capillary membrane. Standard treatments target the wrong pathway entirely." Across the ED, her protocol began showing results. Patients who had been rapidly deteriorating started to stabilize. Oxygen levels improved, and the crushing demand for ventilators began to ease as patients responded to the specialized medication combinations. Dr. Harrison approached her, his expression a mixture of admiration and chagrin. "Patel, I've been treating respiratory emergencies for 8 years, and I thought I knew what I was doing. I was wrong." Maya didn't respond immediately, focused on adjusting the medication dose for a particularly severe case. The patient was a young factory worker, barely in his 20s, who had been at the epicenter of the explosion. His lungs had taken the full brunt of the chemical exposure, and even with Maya's protocol, he was struggling. "Come on," she whispered, adjusting the medication infusion. "You can do this." Slowly, miraculously, his oxygen saturation began to climb. The deadly blue tinge to his skin faded, replaced by healthy pink tones. Maya felt a surge of vindication. This was what she'd been born to do. Not managing hospital politics or following outdated protocols, but actually saving lives by understanding disease mechanisms at a deeper level. "Dr. Patel," called out one of the nurses from across the department, "the patient in Bay 12 is responding. His oxygen level is above 90% for the first time since arrival." Maya felt a surge of relief and pride. Her knowledge of the specific chemical interactions and their effects on lung tissue knowledge that had been dismissed as unnecessary and speculative, was now the difference between life and death for hundreds of patients. "Maya," David's voice came from beside her, stronger now that the crisis was beginning to stabilize. "Ambulance dispatch says they've got at least 50 more severe cases inbound. They want to know our capacity." Maya surveyed the emergency department. Under her direction, the chaotic scene had transformed into an organized response machine. Patients were being treated systematically, the most critical cases stabilizing, making room for the next wave. "Tell them we're ready," she replied. "And make sure they know about our modified protocol for these specific exposures." As the hours passed, Maya moved from patient to patient, adjusting treatments, training staff, and refining her approach based on the responses she observed. The emergency department had transformed under her leadership, becoming a coordinated, effective response unit that processed hundreds of patients with increasingly successful outcomes. Dr. Reynolds had disappeared from the floor, presumably to deal with hospital administration or the press. Maya didn't care. For the first time in 3 years, she was practicing medicine the way she knew it should be practiced, with intelligence, innovation, and deep understanding of underlying mechanisms. "Dr. Patel," Sarah said, appearing beside her as Maya finished treating yet another critical patient. "You've been going non-stop for almost 12 hours. You need to take a break." Maya hadn't even noticed the time passing. The adrenaline of the crisis and the satisfaction of seeing her treatment working had kept exhaustion at bay. "I'm fine," she started to say, but her legs suddenly felt wobbly beneath her. "Sit," Sarah commanded, guiding her to a chair and pressing a water bottle into her hand. "Drink this." Doctor's orders. As Maya took a moment to rest, she looked around the department. The chaos had subsided into controlled, purposeful activity. Patients who would have died under the standard protocol were stable and improving. The staff moved with confidence, having mastered her treatment approach. "Maya," Sarah said quietly, "you saved hundreds of lives today. Do you realize that?" Maya took a long drink of water, letting the reality sink in. Her research, her understanding of chemical pathophysiology, her willingness to challenge established protocols, all of it had come together in this moment of crisis. "I was just doing my job," she replied. "No," Sarah said firmly. "You went way beyond your job today. You're a brilliant physician, Maya, the best I've ever worked with." As the final ambulances delivered the last of the chemical exposure victims, Maya led the emergency department into the 12th hour of their response. The return to normal operations was beginning, the crisis slowly transitioning into routine care. The hospital administrator, Dr. Alan Mitchell, entered the emergency department, surveying the scene with obvious surprise. Maya had never had much interaction with him. He operated in the executive suite, far removed from the daily realities of patient care. "Dr. Reynolds informs me there was an unauthorized deviation from established protocols," he said, approaching Maya with a stern expression. Maya felt a flash of anger. After everything that had happened, after the hundreds of lives saved, this was still about bureaucratic compliance? "Yes, sir," she replied evenly. "I implemented a specialized treatment protocol for the specific chemical exposure we encountered. The standard approach was proving ineffective." Mitchell's eyebrows rose. "And the results?" "Over 500 patients treated, with a predicted mortality reduction of approximately 80% compared to the standard protocol outcomes." Mitchell was silent for a moment, taking in the busy but controlled emergency department around them. "Dr. Patel, I've received calls from the mayor, the fire chief, and 3 news stations, all asking about the miraculous treatment being provided here." He paused, his expression thoughtful. They seemed to be under the impression that Westbrook Memorial had prepared a specialized response protocol specifically for this type of chemical disaster. Maya said nothing, waiting for the reprimand she knew was coming. Instead, Mitchell surprised her. Dr. Reynolds has taken a sudden leave of absence to deal with personal matters. In the interim, I'd like you to brief me on this protocol of yours. The CDC is requesting information to share with other hospitals across the region. Maya felt a wave of vindication wash over her. After years of being ignored and sidelined, her expertise had not only been proven valuable, it had become essential. Of course, Dr. Mitchell, I'd be happy to explain our approach. As she led the hospital administrator through the details of her treatment protocol, Maya caught sight of David Chun watching from across the room, a knowing smile on his face. He gave her a subtle thumbs up, his earlier words echoing in her mind. When things go sideways, they'll come looking for someone who can actually think beyond the protocols. The forgotten doctor had saved 500 lives, and no one would be forgetting Dr. Maya Patel again. 3 months after the chemical disaster, Dr. Maya Patel stood before a packed lecture hall at the National Emergency Medicine Conference, her research data projected on the screen behind her. The audience of physicians, once skeptical, now hung on her every word as she explained the biochemical mechanisms that had made her treatment protocol so effective. The key insight wasn't just understanding the chemicals involved, she explained, highlighting a complex molecular diagram, but recognizing how conventional treatments actually exacerbated the inflammatory cascade in these specific exposures. In the front row, Dr. Alan Mitchell, now Westbrook Memorial's interim chief of medicine, nodded approvingly. Since the crisis, Maya's protocol had been implemented in hospitals nationwide, saving countless lives in smaller industrial accidents that might otherwise have ended in tragedy. As Maya concluded her presentation, the applause was immediate and enthusiastic. She had become something of a celebrity in emergency medicine circles, the doctor who had single-handedly saved 500 lives when the established system failed. Medical journals had published her research. Her treatment approach was being taught in medical schools. The Patel Protocol, as it was now called, had become the gold standard for complex chemical exposures. But returning to Westbrook Memorial brought Maya crashing back to reality. Temporary reassignment, said Dr. Jeffrey Collins, the hospital's new personnel director, sliding a document across his desk. With Dr. Reynolds on extended leave, we need someone to cover the overnight shift in urgent care. Maya stared at the reassignment notice, disbelief washing over her. Urgent care? I'm an emergency medicine specialist with critical care training. Collins shrugged, not meeting her eyes. The board feels your unorthodox approach during the crisis, while effective in that particular situation, raises concerns about your willingness to follow established protocols. My unorthodox approach saved hundreds of lives, Maya said, her voice quiet but intense. And you've been appropriately recognized for that, Collins replied, his tone dismissive. But day-to-day medicine requires consistency and adherence to standards. The urgent care position should be a good fit for your independent thinking. Maya felt a familiar knot forming in her stomach. Despite everything, the lives saved, the validated research, the national recognition, nothing had really changed. The system was closing ranks, shuffling her sideways into a role where her expertise would be wasted on sprained ankles and minor illnesses. This is about Dr. Reynolds, isn't it? Maya asked. She's coming back, and you're clearing the path. Collins' expression confirmed her suspicion before he could deny it. Dr. Reynolds has powerful friends on the board. Her temporary leave is ending next month, and she'll be resuming her duties as Chief of Emergency Medicine. And what about the patients? Maya asked, rising from her chair. What happens the next time the standard protocol fails? The incident was a once-in-a-lifetime event, Collins said, his corporate smile firmly in place. The board is confident that our updated standard protocols are sufficient for normal operations. Maya left the meeting with the reassignment notice burning a hole in her pocket. The hospital corridors, once a place where she felt purpose and belonging, now seemed alien and hostile. Colleagues who had praised her during the crisis now averted their eyes as she passed, unwilling to be associated with someone who had challenged the system and was clearly being punished for it. At the emergency department entrance, she paused, watching the medical teams at work. The department had returned to its pre-crisis routine, senior doctors commanding the newest equipment, residents scrambling to keep up, nurses navigating the complex dance of emergency care. No one seemed to remember that just 3 months ago, the standard approaches had utterly failed, and hundreds would have died without Maya's intervention. They have short memories, don't they? David Chun appeared beside her, his experienced eyes taking in the same scene. Institutional amnesia, Maya agreed, as if the crisis never happened. Oh, it happened, David said. And it'll happen again, in some form or another. Systems like this don't learn from their mistakes, they just paper over them and hope no one notices. Maya fingered the reassignment notice in her pocket. They're sending me to urgent care. Overnight shift. David's eyebrows shot up. Seriously? After everything you did? Reynolds is coming back next month. Can't have the backup doctor outshining the chief, can we? David's weathered face showed a mixture of disgust and resignation. You know, in my 30 years here, I've seen this pattern repeat itself dozens of times. The doctors who actually put patients first get pushed aside by the ones who play politics. It's why I stayed in nurse-less politics, more actual patient care. Maya leaned against the wall, suddenly exhausted. I thought saving all those lives would change things. I thought they'd finally see my value. They see it, David said quietly. That's exactly why they're pushing you out. You showed them. Exposed the flaws in their precious protocols. People like Reynolds can't have someone like you around, constantly reminding everyone that the emperor has no clothes. Maya's pager buzzed a notification for an incoming trauma case. Despite her reassignment, she was still technically on the emergency department roster for the next week. One last week of doing the job she loved before being exiled to the medical equivalent of Siberia. I should go, she said, straightening her white coat. David put a hand on her arm. Maya, you're a brilliant doctor. Don't let them diminish that, no matter where they put you. Maya nodded, but as she walked toward the trauma bay, his words felt like cold comfort. Being brilliant meant nothing if the system wouldn't let you use that brilliance to help patients. The trauma turned out to be a multi-vehicle collision on the Highway 3, critical patients arriving simultaneously. Maya was assigned the least severe of the three, a young woman with potential internal bleeding but stable vital signs. As she worked, Maya couldn't help but notice Dr. Harrison struggling with his patient in the adjacent bay. The patient, an elderly man with a severe head injury, was deteriorating rapidly despite Harrison's interventions. BP's dropping. We need more blood products. Harrison called out, his usual confidence replaced by growing panic. Maya efficiently stabilized her patient, then stepped to Harrison's bay. Need a hand? Harrison barely glanced up, his focus on the failing vital signs. He's crashing and I can't figure out why. CT shows a subdural hematoma, but there's something else going on. Maya quickly reviewed the patient's data, noting subtle inconsistencies in the presentation. Have you checked his medication list? This looks like warfarin overdose complicating the head trauma. Harrison blinked, then checked the medication record. You're right, he's on high-dose warfarin for a mechanical heart valve. How did I miss that? Easy to overlook in a trauma situation, Maya said, already preparing the reversal agent. We need to give prothrombin complex concentrate immediately while neurosurgery gets ready. With Maya's guidance, they stabilized the patient enough for emergency surgery. As the neurosurgeons wheeled him away, Harrison turned to Maya with reluctant respect. Thanks, Patel, you saved my bacon there. Maya nodded, about to respond, when an overhead announcement froze her in place. Code Blue Radiology. Code Blue Radiology. A cardiac arrest in the radiology department was unusual. Patients that were generally stable enough for imaging. Maya and Harrison exchanged a quick glance before both sprinted toward the radiology wing. They arrived to find chaos. A middle-aged woman lay on the floor beside a CT scanner, a radiology technician performing CPR while another staff member fumbled with a crash cart. What happened? Maya demanded, kneeling beside the patient and checking for a pulse. She was fine 1 minute, then collapsed the next. The technician panted between compressions. She was getting a contrast-enhanced CT for abdominal pain. Maya's mind raced through possibilities. Was 4 contrast administered? Yes, about 2 minutes before she collapsed. Anaphylaxis, Maya said immediately. We need epinephrine now. The radiology staff looked confused. But she didn't have any known allergies. We checked. Contrast reactions can happen without prior history, Maya explained, already drawing up the epinephrine. Harrison, take over CPR. As Harrison continued chest compressions, Maya administered the epinephrine and began setting up additional medications. Get me an intubation kit and more epi. We need to establish an airway. The next few minutes were a blur of coordinated emergency care. Maya intubated the patient while directing the team through the anaphylaxis protocol she had helped develop during her fellowship. Slowly, the patient's vital signs began to stabilize. We've got a pulse, Harrison confirmed, relief evident in his voice. Good call on the contrast reaction, Patel. Maya nodded, focused on stabilizing the patient for transfer to the ICU. As the crisis subsided and the patient was moved, she became aware of a crowd that had gathered in the radiology department doorway. Dr. Collins stood among them, his expression unreadable as he watched Maya working. Quite the dramatic save, Dr. Patel, he commented as she passed him on her way out. Just doing my job, Maya replied coolly. Yes, well, your job will be in urgent care starting next week, remember? His smile didn't reach his eyes. Try not to get too accustomed to the excitement. Maya bit back a retort and continued down the hallway. The contrast reaction save would be forgotten by tomorrow, just like her role in the chemical disaster was being systematically erased from institutional memory. No matter how many lives she saved, the hospital administration seemed determined to relegate her to the sidelines. That evening, Maya sat alone in the hospital cafeteria, picking at a salad while reviewing patient charts. The day's events had left her emotionally drained but oddly resolute. If they wanted to waste her talents in urgent care, she would provide the best urgent care possible. If they wanted to pretend she hadn't saved hundreds of lives, she would continue saving them one at a time, without fanfare or recognition. Mind if I join you? Sarah Lynn set her tray down across from Maya without waiting for an answer. You look like you could use a friendly face. Maya managed a tired smile. That obvious, huh? Word travels fast. The urgent care reassignment is all anyone's talking about. Sarah's expression was sympathetic but tinged with caution, the look of someone who wanted to show support without endangering their own position. It's fine, Maya said automatically. Urgent care is an important part of the hospital. Cut the crap, Maya, Sarah replied, lowering her voice. We both know this is Reynolds' revenge for you showing her up during the crisis. It's not right, and everyone with half a brain knows it. Knowing and doing something about it are different things, Maya observed, noticing how the other doctors in the cafeteria kept their distance, despite many of them owing their patients' lives to her protocol. Sarah leaned forward, her voice barely above a whisper. Listen, there's something you should know. Reynolds isn't just coming back as chief of emergency medicine. The board is considering her for the new position of medical director for the entire hospital. Maya felt her appetite vanish completely. You're kidding. I wish I were. If that happens, she'll have even more power to sideline anyone she sees as a threat, which definitely includes you. Why are you telling me this? Maya asked, studying her colleague's face. Because it's not just about you anymore, Sarah replied. Reynolds approached to medicine rigid adherence to protocols. Regardless of outcomes, prioritizing politics over patients, it's dangerous. The chemical disaster proved that. If she gains more institutional power, more patients will suffer. Maya pushed her salad away. What am I supposed to do about it? I'm being exiled to urgent care, remember? Sarah glanced around to ensure no one was listening. There's a hospital board meeting tomorrow night. They're discussing the new medical director position. Normally it's closed door, but as the developer of the protocol that saved hundreds of lives, you might have something relevant to contribute. You want me to crash a board meeting? Maya asked incredulously. I want you to stand up for yourself and for patient care, Sarah corrected. The board needs to hear from someone who puts medicine before politics before they make their decision. Maya considered the suggestion. Confronting the board directly would either force them to acknowledge her contributions or accelerate her professional demise. Either way, at least she wouldn't go quietly into obscurity. I'll think about it, she said finally. Sarah nodded, apparently satisfied. That's all I'm asking. She pushed a coffee across the table. Oh, and I brought you this. You look like you need it. Maya accepted the coffee gratefully, wondering if this small act of kindness might be one of the last she'd receive at Westbrook Memorial. The following day passed in a blur of routine cases and paperwork. Maya treated patients on autopilot, her mind preoccupied with Sarah's revelation about Reynolds' potential promotion and the upcoming board meeting. By late afternoon, she had made her decision. If her career at Westbrook was effectively over. Anyway, she might as well go down fighting for what she believed in. At 7 p.m., Maya stood outside the boardroom, her heart pounding but her resolve firm. Through the wood-paneled doors, she could hear the muffled voices of the hospital's leadership discussing budgets, policies, and staffing, the bureaucratic machinery that often seemed to forget its purpose was supporting patient care. She took a deep breath and pushed open the door. The conversation inside stopped abruptly as a dozen pairs of eyes turned toward her. At the head of the table sat Dr. Mitchell, looking surprised but not entirely displeased by the interruption. Beside him, Jeffrey Collins frowned disapprovingly. Dr. Patel, Mitchell said, recovering quickly. This is a closed board meeting. I apologize for the interruption, Maya said, her voice steadier than she felt. But I understand you're discussing the new medical director position, and I believe I have relevant information that should be considered. Collins stood, his expression thunderous. This is completely inappropriate. Dr. Patel, you need to leave immediately. Actually, said an older woman whom Maya recognized as Catherine Williams, the board chairperson, I'm curious what Dr. Patel has to say. After all, her protocol during the chemical disaster brought this hospital international recognition. Collins sat down reluctantly, and Mitchell gestured to an empty chair. Please, Dr. Patel, join us. But be brief, we have a full agenda. Maya remained standing, knowing that what she was about to say would probably end her career at Westbrook, but unable to stay silent any longer. 3 months ago, she began, this hospital faced an unprecedented crisis. Hundreds of patients, with complex chemical exposures that our standard protocols couldn't address. When I proposed an alternative treatment approach based on years of research, I was threatened with disciplinary action. She looked around the table, meeting the eyes of each board member. Despite those threats, I implemented my protocol. It saved approximately 500 lives. This isn't speculation. It's documented in our own hospital records and validated by external review. The board members shifted uncomfortably, but no one interrupted. After the crisis, Maya continued, my protocol was celebrated publicly. This hospital took credit for the innovation and quick thinking that saved those lives, but internally, nothing changed. The same system that initially rejected my approach is now working to remove me from emergency medicine entirely. Dr. Patel, Collins interjected, your reassignment is a routine staffing adjustment, not a punishment. Is it? Maya challenged. Or is it preparation for Dr. Reynolds' return and potential promotion to medical director? A murmur ran around the table, and Maya knew she had struck a nerve. My concern isn't for my career, she pressed on. It's for patient care. The chemical disaster exposed a dangerous flaw in our medical leadership, a preference for adhering to established protocols, even when they're failing, rather than adapting to save lives. Promoting that approach to an even higher level of authority puts future patients at risk. That's quite an accusation, said Catherine Williams, studying Maya with newfound interest. Dr. Reynolds has led our emergency department effectively for years. Has she? Maya asked quietly. Or has she created a culture where following protocols matters more than patient outcomes? Where doctors who question ineffective approaches are sidelined rather than heard? The measure of medical leadership isn't how well we follow rules. It's how many lives we save, especially when the rules aren't working. The boardroom fell silent as her words hung in the air. Maya could feel the weight of what she had just done challenging, not just Reynolds, but the entire administrative approach to medicine at Westbrook. Thank you for your perspective, Dr. Patel, Mitchell said finally, his tone carefully neutral. The board will certainly take your concerns into consideration. It was a dismissal, and Maya knew it. She had said her piece, and now her fate was in their hands. With a brief nod, she turned and left the boardroom, the door closing behind her with a quiet but definitive click. As she walked through the quiet hospital corridors, Maya felt strangely at peace. Whatever happened next, whether termination, permanent exile to urgent care, or some miraculous recognition of her concerns, she had stood up for what she believed in. She had refused to be silenced, to be the backup doctor who knew her place and never challenged the status quo. Her pager buzzed, pulling her from her thoughts. The message was brief but urgent. Ed overflow. All available physicians report immediately. Maya hesitated only a moment before changing direction, heading toward the emergency department. Whatever administrative drama was unfolding, patients needed care, and that's what she had sworn an oath to provide. As she pushed through the emergency department doors, she was met with controlled chaos. Every bed was filled, and staff rushed between patients with urgent purpose. What's happening? She asked a harried-looking nurse. Bus crash on the interstate, the nurse replied without stopping. Multiple critical trauma patients arriving by ambulance and helicopter were activating the mass casualty protocol. Maya's heart sank. Another crisis, another test of the system's ability to respond effectively. She spotted David across the department and made her way to him. They're calling in everyone, he confirmed before she could ask. It's bad, at least 30 critical. Patients inbound, many more with serious injuries. Where do they need me? Maya asked, already reaching for a trauma gown. David's expression was grim, determined. Everywhere. As Maya prepared to join the response, she couldn't help but wonder if the system that had worked so hard to marginalize her would now, in this moment of crisis, finally recognize what she had known all along, that in medicine, expertise and adaptability save lives, not rigid adherence to protocols or political maneuvering. The first ambulances were arriving, and there was no more time for reflection. The backup doctor was about to step into the spotlight once again, ready to do what she did best: save lives when it mattered most. The emergency department doors burst open as the first ambulance crew rushed in with a gurney. Male, mid-40s, traumatic chest injury with suspected tension pneumothorax. BP dropping, oxygen sat at 82% and falling. The paramedic shouted. Over the growing commotion, Maya immediately stepped forward. Bay 3, let's move. She ran alongside the gurney, already assessing the patient whose lips were turning blue as he struggled for each breath. The right side of his chest was visibly distended, a clear sign of trapped air compressing his lung and potentially his heart. "I need a chest tray and 14-gauge needle now," she called to the nurse who appeared at her side. Without hesitation, Maya identified the landmarks on the patient's chest, swabbed the area with antiseptic, and drove the needle between his ribs. A rush of air confirmed her diagnosis. The tension pneumothorax was relieved, at least temporarily. The patient's oxygen levels began to improve immediately. "Let's get a chest tube in and prep for possible thoracotomy if he destabilizes again," Maya directed, her voice calm despite the chaos unfolding around her. As she worked, she was vaguely aware of Dr. Harrison entering the adjacent bay with another critical patient. Through the curtain, she heard him calling for a neurosurgery consult for a severe head trauma. More ambulances were arriving by the minute, their sirens creating a continuous wail outside the hospital doors. "Dr. Patel, we need you in Bay 5, a nurse called urgently. "Pregnant woman with abdominal trauma." "I'll be right there," Maya replied, turning to the resident who had joined her. "Can you place the chest tube? I've prepped the site." The young doctor nodded confidently. "I've got this." Maya moved quickly to Bay 5 where a young woman, visibly pregnant and in obvious distress, was being transferred from an ambulance gurney. "What do we have?" she asked, immediately noting the bruising across the woman's abdomen. "Jennifer Torres, 28 weeks pregnant, ejected from the bus during the crash," the paramedic reported. "Significant abdominal trauma, fetal heart tones present but weak at 100 BPM. Maya's mind raced through the protocols for traumatic injury in pregnancy. "Get OB here stat and ultrasound. We need to assess for placental abruption and uterine rupture." As she examined the patient, Maya noticed subtle signs that worried her. The woman's abdomen felt rigid in a pattern that didn't match the external bruising, suggesting internal bleeding that standard imaging might miss. The ultrasound technician arrived with the portable machine. "Standard fast exam?" he asked, referring to the focused assessment with sonography for trauma protocol. "No," Maya said, her instincts telling her something wasn't right. "I need a detailed view of the placental attachment and the retroperitoneal space behind the uterus." The tech looked confused. "That's not standard protocol for trauma ultrasound, Dr. Patel." "I know, but this presentation suggests possible retroperitoneal bleeding that could be missed on a standard fast," Maya explained, already guiding the ultrasound probe to the area of concern. "There, you see that dark space behind the uterus? That's blood collecting where it shouldn't be." The obstetrician arrived, quickly reviewing Maya's findings. "Good catch, Dr. Patel. This type of bleeding can be easily missed. We need to get her to the OR immediately." As they prepared the patient for emergency surgery, Maya heard her name being called again. "Dr. Patel to Bay 8. Pediatric trauma." The night continued in a blur of critical decisions and life-saving interventions. Maya moved from patient to patient, each presenting unique challenges that required quick thinking and adaptations to standard protocols. In one case, she recognized the signs of fat embolism syndrome before it could progress to respiratory failure. In another, she identified a subtle cardiac contusion that the initial EKG had missed. 4 hours into the crisis, Maya paused at the central station to update patient charts and check the department status. The initial surge had been managed, with the most critical patients either stabilized or in surgery. But the emergency department remained full, every bed occupied with victims from the bus crash. "Dr. Patel," David appeared at her side, handing her a cup of water. "You need to hydrate. You haven't stopped moving since this started." Maya accepted the water gratefully. "How are we doing on critical cases?" "Better than expected," David replied. "We've had 0 mortality so far, which is miraculous considering the severity of injuries we've seen. He gave her a knowing look. Your rapid intervention with that first pneumothorax case likely saved his life. And that pregnant woman? The surgeon said if you hadn't caught that retroperitoneal bleed when you did, we would have lost both mother and baby. Maya nodded. Too tired to feel pride or vindication. Just doing my job. A job they were trying to take away from you just hours ago, David reminded her. Speaking of which, Maya followed his gaze to see Dr. Mitchell and several board members who had arrived to observe the emergency response. They stood near the department entrance, watching the coordinated activity with expressions ranging from concern to admiration. They're impressed, David said quietly, as they should be. This response has been textbook perfect under impossible conditions. Before Maya could respond, alarms blared from Bay 12, where one of the stabilized patients had suddenly deteriorated. She rushed to the bedside, finding a teenage boy in acute respiratory distress despite being on high-flow oxygen. What happened? She demanded, quickly assessing his vital signs. He was stable 1 minute, then his oxygen levels just crashed, the nurse reported, looking frightened. Maya listened to the boy's chest, noting diminished breath sounds on both sides despite clear initial X-rays. Something wasn't adding up. She quickly reviewed his chart, noting the mechanism of injury. He had been trapped under debris for nearly an hour before being extracted. This could be delayed presentation of crush syndrome with pulmonary involvement, she said, remembering similar cases from her research. We need to check his creatinine kinase levels and start him on sodium bicarbonate and aggressive fluid management. Crush syndrome? But he has no visible crush injuries, one of the residents objected. Sometimes the damage is internal, Maya explained. The myoglobin released from damaged muscle can cause acute respiratory distress as a secondary effect. She ordered the necessary tests and treatments, then added, and get ultrasound in here. I want to check for pulmonary edema patterns that might not show on the initial X-ray. The lab results confirmed her suspicion massively elevated. Muscle enzymes indicating significant muscle damage that had not been immediately apparent. The ultrasound revealed early signs of the pulmonary involvement she had predicted. Start the bicarbonate drip now and push fluids, Maya directed. If we don't get ahead of this, he'll develop acute kidney injury next. As the treatment began, she noticed Dr. Mitchell and Catherine Williams, the board chairwoman, watching from just outside the bay. They had witnessed her diagnostic process and the residents' initial skepticism. Maya ignored their presence, focused entirely on stabilizing her patient. Gradually, the boy's oxygen levels began to improve. The immediate crisis passed, though Maya knew he would need careful monitoring for kidney complications in the coming days. Nice work, Dr. Patel, Dr. Mitchell said as she exited the bay. That was an impressive diagnosis. Thank you, Maya replied simply, already moving toward her next patient. Dr. Patel, Catherine Williams called after her. When you have a moment, I'd like to speak with you. Maya nodded but continued her rounds. Whatever administrative matters awaited could wait until her patients were stable. By dawn, the emergency department had processed over 50 injured patients from the bus crash, with remarkably few serious complications given the severity of the initial presentations. As the crisis phase ended and routine care resumed, Maya finally found time to meet with Williams, who had waited patiently in the physician's lounge. You wanted to see me? Maya asked, exhaustion evident in her voice despite her professional demeanor. Catherine Williams studied her thoughtfully. I've been observing the emergency response all night. Your performance was exceptional, Dr. Patel. Thank you, but it was a team effort, Maya replied automatically. Of course, Williams agreed. But teams need leaders, people who can make difficult decisions under pressure and recognize when standard approaches aren't sufficient. She paused. Your comments at the board meeting yesterday have taken on new significance after witnessing your work tonight. Maya waited, too tired to guess where this conversation was heading. The board was already discussing Dr. Reynolds' potential promotion when you interrupted us, Williams continued. What you may not know is that several members, myself included, had expressed reservations about her leadership style, particularly her rigid adherence to protocols, even when circumstances might warrant flexibility. This was news to Maya. She had assumed the entire board supported Reynolds' approach. Your intervention during the chemical disaster was apparently not the first time her insistence on protocol adherence had created problems, Williams explained. There have been other incidents, less dramatic but concerning nonetheless. Your appearance at our meeting simply brought these concerns into sharper focus. Maya leaned against the wall, processing this information. I didn't know. You wouldn't have, Williams said. These discussions happen behind closed doors. But your willingness to speak up, both during the chemical crisis and at our meeting, demonstrated something important. True medical leadership means putting patient outcomes above institutional politics. She handed Maya a folder. This is a proposal the board was already considering before last night's events. We'd like you to review it and give us your thoughts. Maya opened the folder to find a detailed outline for a new position, Medical Innovation Director, responsible for evaluating and implementing emerging treatment approaches and ensuring that hospital protocols remained responsive to evolving medical evidence. We created this position with someone like you in mind, Williams explained. Someone who understands both the importance of protocols and when they need to be adapted or updated. Last night's emergency response only confirmed our belief that you would be the right person for this role. Maya stared at the proposal, scarcely able to believe what she was reading. This is unexpected. Is it? Williams asked with a slight smile. You've demonstrated extraordinary clinical judgment and courage in challenging outdated approaches. Those are precisely the qualities we need as healthcare continues to evolve. What about Dr. Reynolds? Maya asked cautiously. Dr. Reynolds will remain Chief of Emergency Medicine when she returns, Williams replied. But the medical director position has been reconsidered. Instead, we'll be creating two complementary roles: Clinical Standards Director, focusing on protocol development and implementation, and your position, focusing on innovation and adaptation. She stood to leave. Review the proposal. We can discuss details once you've had time to rest and consider it properly. As Williams departed, Maya sank into a chair, the proposal still open in her hands. After years of being sidelined and dismissed as merely the backup, her expertise and approach to medicine were not only being recognized, but institutionalized at the highest level. David found her there, still processing the unexpected turn of events. You look like you've seen a ghost, he observed, sitting beside her. Maya handed him the proposal without comment. He scanned it quickly, his eyebrows rising. Well, I'll be damned, he said finally. They actually learned something. It doesn't feel real, Maya admitted. Yesterday, I was being exiled to urgent care. Today, they're offering me a director-level position. That's what happens when you refuse to be silenced, David said. Sometimes the system actually works the way it's supposed to. He handed the proposal back to her. You're going to take it, right? Maya hesitated. I need to think about it. There's a lot to consider. Like what? David looked genuinely confused. This is everything you've been fighting for, a chance to actually change how medicine is practiced here. It's also a political position, Maya pointed out. I'd be working directly with Reynolds, who has made it very clear how she feels about me and my approach. Ah, David nodded in understanding. You're worried about trading your stethoscope for a boardroom seat, becoming part of the system you've been fighting against. Maya smiled tiredly. Something like that. Consider this, David suggested. Sometimes the only way to change a system is from within. As backup doctor in the ED, you could save lives one by one. In this new role, you could implement changes that save thousands. He stood up, stretching his back after the long night. Besides, if last night proved anything, it's that you'll never be just an administrator. When patients need you, you'll be there, title or no title. As David left, Maya closed the folder and leaned back in her chair. The events of the past 24 hours felt surreal, from confronting the board to managing a mass casualty incident to being offered a position created specifically for her approach to medicine. She closed her eyes, allowing herself to imagine the possibilities. The Medical Innovation Director role would give her the authority to review and update protocols, integrate research findings into clinical practice, and ensure that physicians, like her former self, wouldn't be sidelined for questioning ineffective approaches. But David was right about the most important thing. No matter what title she held, when patients needed her, she would be there, doing what she had always done, putting their care above politics, protocols, or personal advancement. Her pager buzzed, interrupting her thoughts. A message from the ICU. Crush syndrome patient developing complications. Your expertise requested. Maya smiled to herself as she stood, leaving the proposal on the chair. The future could wait a few more hours. Right now, a patient needed the backup doctor. By the time Maya arrived in the ICU, the teenage crush syndrome patient had developed the kidney complications she had anticipated. His creatinine levels were rising dangerously, and the nephrologist was considering emergency dialysis. "Dr. Patel, glad you're here," the ICU attending greeted her. "We've started continuous renal replacement therapy, but his myoglobin levels are still through the roof. Standard protocol isn't cutting it." Maya reviewed the lab results, noting that while the initial treatment she had ordered had prevented immediate respiratory failure, the secondary kidney damage was progressing faster than expected. "We need to be more aggressive with the alkalinization," she said, making quick calculations, "and add mannitol to the protocol to promote myoglobin clearance." The nephrologist frowned. "That's not the standard approach for crush syndrome at this stage." "No, but it's what this patient needs," Maya replied, explaining her reasoning based on both published research and her own experience with similar cases. "The standard protocol assumes a certain timeline of myoglobin release, but given his delayed presentation and the pattern of his enzyme elevations, he's still actively releasing muscle breakdown products." After some discussion, the nephrologist agreed to modify the treatment plan. As they implemented the changes, Maya noticed Dr. Mitchell observing from the nurse's station. "Making more protocol adjustments, Dr. Patel?" he asked when she joined. Evidence-based adjustments," Maya clarified. "The standard protocol is designed for the average presentation, but few patients read the textbook before getting sick." Mitchell smiled. "That's precisely the perspective we need in our leadership. Have you had a chance to review the proposal Catherine gave you?" "Not thoroughly," Maya admitted. "I've been a bit busy." "Of course. But I hope you'll consider it seriously. The position would include protected clinical time. We don't want to lose your skills on the front lines." Maya was surprised by this detail. "That wasn't mentioned in the initial overview." "It's non-negotiable from our perspective," Mitchell explained. "Your value to this institution isn't just in your ideas about medical innovation, it's in your direct patient care. Last night proved that beyond any doubt." As Mitchell departed, Maya felt a subtle shift in her perspective. Perhaps the new position wouldn't require sacrificing her identity as a physician after all. Perhaps it could actually amplify her impact, allowing her to save lives both directly through patient care and indirectly through system improvements. She completed her assessment of the crush syndrome patient, confirmed that his condition was stabilizing with the modified treatment approach, and finally headed home after more than 24 continuous hours at the hospital. As she drove through the early morning light, Maya reflected on the journey that had brought her to this crossroads. From marginalized backup to emergency department, Hero to potential medical director, it was a transformation she could scarcely have imagined just days ago. But the true transformation, she realized, wasn't in her title or position. It was in her refusal to be silenced, to compromise patient care for political convenience, or to accept the limitations others tried to impose on her expertise. The backup doctor had become something much more powerful, a catalyst for change in a system desperately in need of evolution. When Maya returned to the hospital 48 hours later, rested and clear-headed, she carried the annotated proposal for the Medical Innovation Director position. She had spent hours reviewing it, adding suggestions and refinements that would ensure the role truly advanced patient care, rather than just adding another layer of bureaucracy. To her surprise, she found Catherine Williams waiting for her in the physician's lounge, rather than in an administrative office. "I thought we might have this conversation where you feel most at home," Williams explained, gesturing to the clinical environment around them. Maya appreciated the gesture. "I've reviewed the proposal," she said, handing over her annotated copy. "I've made some suggestions that I think would strengthen the position's impact." Williams scanned the document, nodding appreciatively at Maya's notes. "These are excellent additions. Particularly the requirement for the director to maintain regular clinical duties and the creation of a rapid protocol review process for emergency situations. Those are non-negotiable for me," Maya said firmly. "This position can't just be about reviewing research in an office. It has to be grounded in real patient care." "Completely agreed," Williams replied. "Which is why we're prepared to accept all of your proposed modifications." She offered Maya a formal letter. "This makes it official if you choose to accept." Maya took the letter, still hardly believing that the institution that had once tried to sideline her was now offering her a platform to transform its approach to medicine. "There's one more thing you should know," Williams added. "Dr. Reynolds has been informed of this new position and your selection for it." She was less than enthusiastic initially. Maya wasn't surprised. "I imagine she sees it as undermining her authority." "Actually," Williams said with a slight smile, after reviewing the documentation of both the chemical disaster response and the recent bus crash, she acknowledged reluctantly that there might be value in a more flexible approach to protocols. "In certain situations." Maya raised her eyebrows in disbelief. "Reynolds said that?" "Not in so many words," Williams admitted. "But she didn't oppose your appointment, which for Victoria Reynolds is practically an endorsement." As Maya considered this unexpected development, her pager buzzed with a familiar code. "Multiple trauma incoming." "I have 5 minutes." Williams smiled knowingly. "Go. We can finalize the details later. Your patients need the backup doctor." Maya handed the letter back to Williams and grabbed her stethoscope. "They don't need the backup doctor," she corrected, heading toward the emergency department with renewed purpose. "They just need a doctor who puts their needs first, title or no title." As she pushed through the emergency department doors, Maya was greeted by a team ready for action. David Chun caught her eye from across the room and gave her a thumbs up, while Dr. Harrison nodded respectfully as she joined him at the trauma bay. The backup doctor had become something far more important, a reminder that in medicine, true expertise isn't measured by titles or adherence to protocols, but by the lives saved when conventional wisdom fails. And as the emergency doors burst open with the first incoming trauma patient, Dr. Maya Patel was exactly where she belonged, at the front lines of medicine, ready to use every ounce of her knowledge, skill, and courage to save lives, one patient at a time. 1 year later, the auditorium of Westbrook Memorial Hospital buzzed with anticipation as healthcare professionals from across the country filled every seat. The annual Medical Innovation Conference, once a small perfunctory gathering, had transformed into one of the most anticipated events in the medical community. At the center of this transformation stood Dr. Maya Patel, preparing to deliver the keynote address. Behind the stage, Maya reviewed her notes one final time. Her presentation, breaking the protocol paradox, when following the rules costs lives, represented a year's worth of data collected since the implementation of her adaptive treatment framework at Westbrook. 5 minutes, Dr. Patel, a conference organizer, informed her with a respectful nod. Maya took a deep breath, adjusting the lapel of her blazer. The past year had been a whirlwind of change, both for her personally and for medicine at Westbrook. As Medical Innovation Director, she had systematically reviewed and updated dozens of treatment protocols, always balancing the need for standardization with the flexibility required for complex cases. Need a pep talk? David Chun appeared. Beside her, his nurse's scrubs replaced by a conference polo shirt. He had been promoted to Director of Nursing Excellence 6 months ago, part of the institutional transformation that Maya had helped catalyze. Just gathering my thoughts, Maya replied with a smile. Hard to believe where we were a year ago. You in the forgotten corner of the ed, me just trying to keep my head down and do my job, David mused. And now look at us changing how medicine is practiced. The stage manager signaled it was time. Maya squared her shoulders and walked onto the stage, greeted by enthusiastic applause from hundreds of healthcare professionals, many of whom had implemented versions of her adaptive treatment frameworks at their own institutions. Good morning, Maya began, her voice strong and clear. A little over a year ago, I was known around Westbrook Memorial as the backup doctor, the one assigned to the least critical patients, using outdated equipment in the far corner of the COVID emergency department. She paused, letting the audience absorb the contrast between that image and the confident medical leader standing before them. Then came a day when 500 lives hung in the balance, when standard protocols failed, and when being just the backup wasn't an option anymore. Maya clicked to her first slide, showing data from the chemical disaster response. What I'm about to share isn't just my story. It's about what happens when medical institutions value rigid adherence to protocols over the expertise and judgment of their practitioners. It's about the patients who pay the price for that rigidity and about how we can do better. For the next 40 minutes, Maya presented compelling evidence demonstrating how adaptive protocols guidelines that incorporated decision points where physician judgment could modify standardized approaches had improved outcomes across multiple departments at Westbrook. The data is clear, she concluded, displaying the final outcomes slide. Since implementing adaptive protocols throughout our institution, we've seen a 23% reduction in mortality for complex cases, a 17% decrease in average length of stay, and a 31% reduction in treatment complications. She paused, scanning the attentive faces in the audience. But statistics only tell part of the story. The real measure of our success is in the lives saved patients, who would have been lost if we had rigidly followed outdated protocols instead of adapting to their specific needs. The screen behind her changed to show a photograph of a smiling teenage boy standing beside his parents, the crush syndrome patient from the bus crash. This is Jordan Reynolds, no relation to our former chief of emergency medicine, Maya added with a small smile that elicited knowing chuckles from the audience. Jordan was trapped under debris for nearly an hour during a major bus accident. His presentation didn't match any textbook case of crush syndrome, and standard protocols would have failed him. By adapting our approach to his unique physiology, we not only saved his life but preserved his kidney function. The screen changed to show Jordan running across a finish line in a track meet. Today, Jordan is back to being a star athlete at his high school with no lasting effects from his injuries. Maya clicked through several more patient stories, each representing a case where adaptations to standard protocols had made the critical difference in outcomes. These successes weren't achieved by abandoning protocols, she emphasized. Protocols provide essential structure and guidance, but they must serve medicine, not the other way around. When we elevate protocols above medical judgment, we create a paradox where the very guidelines intended to improve care can actually harm patients. She clicked to her final slide, which displayed the core principles of Westbrook's new adaptive protocol framework. The solution isn't choosing between rigid standardization and complete individualization. It's creating intelligent frameworks that incorporate both protocols, that identify key decision points where clinical judgment and patient-specific factors should drive variations in care. The applause was immediate and sustained as Maya concluded her presentation. She fielded questions for another 20 minutes, addressing practical concerns about implementation, measuring outcomes, and navigating institutional resistance. The session ended and the audience dispersed for break. Maya found herself surrounded by physicians, eager to discuss their own experiences with protocol limitations. Among them was a distinguished older doctor whose name badge identified him as Dr. Robert Chun, Chief Medical Officer of Pacific Northwest Healthcare System. "Dr. Patel," he said, shaking her hand firmly. "That was the most sensible presentation on medical protocols I've heard in 30 years of practice. We've been struggling with these exact issues across our 15 hospitals." "Thank you, Dr. Chen," Maya replied. "It's been a challenging but rewarding journey implementing these changes. I'd like to discuss that journey in more detail," he said. "My board has authorized creation of a system-wide position, Executive Director of Clinical Innovation, to address exactly the issues you've highlighted. We'd like to talk to you about taking on that role." Maya was momentarily speechless. Pacific Northwest was one of the largest healthcare systems in the country, with a reputation for cutting-edge medical practice. "I'm flattered," she managed. "But I'm quite committed to Westbrook at the moment." Dr. Chun smiled. "I expected you might say that. The offer remains open if your circumstances change. In the meantime, perhaps you'd consider consulting with US on implementing your adaptive framework." "I'd be happy to discuss that possibility," Maya agreed. As Dr. Chun moved away, Maya felt a tap on her shoulder. She turned to find Dr. Victoria Reynolds standing behind her, looking uncomfortable but determined. "Victoria," Maya said, genuinely surprised. Reynolds had returned to her position as Chief of Emergency Medicine 6 months ago, but their interactions had been minimal and strictly professional. "I didn't know you were attending the conference." "I wasn't planning to," Reynolds admitted. "But several board members suggested I should hear your presentation." She hesitated, clearly struggling with what she wanted to say. "Your results are impressive. The data can't be ignored." Coming from Reynolds, this was extraordinary praise. "Thank you," Maya said simply. "I still believe in the importance of standardization," Reynolds continued, her voice lowered so only Maya could hear. "But I've been reviewing our outcomes data since implementing your adaptive frameworks, and—" She paused. "I was wrong about some things." Maya waited, sensing there was more. "The chemical disaster," Reynolds said finally. "If we had followed standard protocols, we would have lost hundreds of patients. I wasn't ready to admit that until now." The admission clearly cost Reynolds significant pride. Maya nodded, acknowledging the courage it took to make such a concession. "Standardization and adaptation aren't mutually exclusive," she offered. "Both have their place in excellent medical care." Reynolds nodded stiffly. "Perhaps we could discuss modifications to the emergency department protocols next week. There may be opportunities for improvement." "I'd welcome that conversation," Maya replied sincerely. As Reynolds walked away, David appeared at Maya's side. "Did I just witness Victoria Reynolds admitting she was wrong about something? Should we check if hell has frozen over?" Maya laughed. "People can change, David. Sometimes they just need compelling evidence." "Speaking of evidence," David said, "have you seen the national data? Your adaptive protocol framework is being implemented in 27 major hospital systems now. with preliminary outcomes showing similar improvements to what we've seen at Westbrook. Maya felt a surge of pride and satisfaction. What had begun as a desperate effort to save lives during a crisis had evolved into a movement that was transforming medical practice across the country. But just as a driver might need to detour around unexpected construction or traffic, physicians sometimes need to navigate around the unique obstacles a specific patient presents. The skill lies in knowing when the standard route is still best, and when an alternative path will get you there more safely. After the teaching session, Maya made her way to her office, no longer a corner desk in a forgotten section of the ed, but a proper space with windows overlooking the hospital grounds. On her desk sat a framed photograph of baby Maya Torres, alongside recognition awards from medical organizations and thank you letters from patients whose lives had been saved by adaptive protocols. A knock at her door revealed Dr. Mitchell. "Got a minute, Maya? I wanted to share some news." "Of course," she replied, gesturing to a chair. "The board just approved expansion of the adaptive protocol framework to all 17 hospitals in our network," Mitchell announced. "Your position is being elevated to system-wide Director of Medical Innovation, with a team of physician leaders at each facility implementing the framework under your guidance." Maya sat back, processing the implications. "That's a significant expansion." "It's necessary," Mitchell said simply. "The outcomes data is irrefutable. What you've built here isn't just improving care at Westbrook. It has the potential to transform healthcare delivery across our entire system and beyond." As Mitchell outlined the expanded role, Maya thought about the journey that had brought her here, from marginalized backup to respected innovator, from fighting for recognition to leading a movement that was changing how medicine was practiced. Up next, you've got 2 more standout stories right on your screen. If this one hit the mark, you won't want to pass these up. Just click and check them out. And don't forget to subscribe and turn on the notification bell so you don't miss any upload from us.